Okay, good morning, everyone. I'm going to call the Health, Human Services, Finance, and Policy Committee to order. The first agenda item is to take the roll. Ms. Hanson, can you please take the roll?
Of course. Good morning, everyone. Chair Schultz.
Present.
Vice Chair Bonner.
Present.
Minority Lead Albright.
Present.
Representative Bolden.
Present.
Representative Burkle.
Present.
Representative Fisher.
Fisher present.
Representative Frederick.
Present.
Representative Hanson.
Present.
Representative Keel. Representative Liebling.
Present.
Representative Moeller.
Present.
Representative Knorr.
Present.
Thank you. Representative Novotny.
Present.
Representative Pearson.
Present.
Representative Pinto.
Present.
Representative Rasmussen.
Present.
Representative Robbins.
Present.
Representative Sandell.
Present.
Representative Schumacher.
Schumacher, present.
Thank you all.
Thank you. We have a quorum. Representative Rasmussen, would you like to move the minutes from January 26th?
Yes, Madam Chair.
Okay. Representative Rasmussen moves the minutes from January 26th of 2021. Any discussion or corrections? Hearing none, all those in favor of approving the minutes, say aye.
Aye.
Aye. Any opposed? Okay, the minutes for January 26th, 2021 are approved. Okay, this morning, members, we are going to hear about the Families First program. This is a program that was passed by the federal government in 2018, and it changes the way child welfare services are provided. It's trying to keep children in their homes and reduce out-of-home placement. And then I'm going to highlight some of the recommendations from the Select Committee on Racial Justice. Tomorrow, we are going to hear information about the budget, and then we'll be meeting next Tuesday. So I'm going to introduce the first speaker. We're going to go through the presentation, and then I will ask for questions, and we should have plenty of time for questions after the presentation. So our first presenters are from DHS, the Division Director, Jamie Sorensen. She heads up the Child Safety and Permanency Division, and then Acting Assistant Commissioner Lisa Bailey from the Children and Family Services Administration. Welcome to the committee. Please proceed with your presentation.
Hey, good morning, committee members. Good opportunity to be here with you this morning to talk about Family First Preservation Services Act, a big piece of federal legislation that we've been working on for some time. Jennifer Sommerfeld is going to help out with slides. And so as we think about Family First, there's two primary goals. And it is the result of major amendments to Title 4E and Title 4B. The Act is designed to reduce reliance on congregate care residential placements by transferring the expense from the federal level to the local level, meaning states and counties and tribes. Secondly, the Act allows for Title 4E to be utilized for family preservation or prevention services through established and approved evidence-based practices. Title 4E was established in 1980 to provide financial support to states to offset payments for foster care and adoption assistance, and to provide protections for children. Title 4E is a child-specific entitlement. Originally, Congress was concerned with the growing number of children in foster care who have been placed away from their parents' caregivers for long periods of time and with no formal plan for achieving permanency. In 2008, kinship assistance payments were added under Title 4E. To give you an idea of the scale of these funds for our state, in federal fiscal year 20, Minnesota received $122 million to offset payments made on behalf of children in foster care, kinship, and adoptive families. The way Title IV-E works, the organizations, the entities who pay for the placements receive the reimbursement. In Minnesota, the state and counties and tribes participating in the American Indian Child Welfare Initiative pay for these costs, and the federal reimbursement is shared between them and in some instances through the North Star Care for Children structure. In order for a cost to be eligible for reimbursement, the individual child must meet specific eligibility criteria, and the specific family, foster home, group home, or child's residential facility must also meet specific eligibility criteria such as Adam Walsh fingerprint-based background checks and specific required court-ordered language regarding reasonable efforts to prevent removal and contrary to welfare for a child to remain in familial home, as well as permanency timelines with court oversight must be met. Title IV-E provides financial support to offset administrative costs associated with these three programs, as well as funding training for child welfare workforce through initiatives such as our Minnesota Child Welfare Training Academy. And most Title IV-E reimbursements are at 50%, but training is reimbursed at a rate of 75%. Slide number 3, primary reasons why Family First was enacted, and you can see 4 of them articulated here. It's important to note that when a county or tribe places children in corporate foster homes, group homes, or children's residential treatment centers beginning October 1st, 2021, this year, if those facilities have not been certified by the state to have met the new Qualified Residential Treatment Program, QRTP, you'll hear that acronym a couple times today. Those standards have not been approved by the state as Title IV-E facility. There will be no federal share to help offset these placement costs. Counties and tribes would therefore be 100% financially responsible. Some facilities will be ready, but many likely will not. And this is a cost shift from the federal to the local level. Slide number 4. This is just a visual description that provides some distinguishing between traditional Title IV-E reimbursement and placement costs. And then it, on the left-hand side, provides a description of the prevention or family preservation infrastructure that's been added to Title IV-E. The National Family First Preservation Services Clearinghouse is where the evidence-based services that are allowable for the prevention portion are held. Title IV-E funding is available for time-limited one-year prevention services in the categories of mental health, substance abuse, and/or in-home parent skill-based programs, where a child is determined to be at risk of entering foster care absent these family preservation or prevention services. Slide number 5. Family First is significant and expansive in terms of its child welfare legislation. It contains multiple deadlines and compliance requirements. We have met all deadlines for Family First to date, and I will highlight the following items on slide number 5. Looking at the criminal record registry checks, that's something that's been completed. There were items in the last legislative session that moved Minnesota toward compliance with the federal act, amendment of the statute modifying Chafee foster care independence program, and then also amended model foster care standards in the state Title IV-E plan, which is our federal 4E plan that we submit on an intermittent basis. Slide number 6, we have one more major required deadline to meet, which is October 1st, 2021, in order to be in compliance with the Family First residential services requirements for children placed in congregate care settings. We're thankful that the legislature supported our initial 2019 request for essential staffing resources to meet this requirement. As you may know, there is significant work yet to be completed, especially in the area where the state will be required to take on new responsibilities for certifying facilities to become QRTPs. For designing and implementing new assessment processes for placement in QRTPs and for monitoring systems to ensure local child welfare administering agencies are following requirements for children who have extended placements in QRTPs. Minnesota's Title IV-E reimbursements for foster care, kinship, and adoption assistance could be in jeopardy if we are not in compliance by October 1, 2021. Minnesota receives over $100 million annually in Title IV-E reimbursements for these programs. Slide number 7. The other major component of Family First is for prevention, family preservation services, and implementation does not actually have a hard deadline. States can submit their 5-year Family First prevention plan at any time, but until the plan has been submitted and federally approved, no Title IV-E reimbursements are available. Department staff are working to submit the prevention plan this summer for federal approval. Transitioning to slide 8, the department and legislature has worked together to accomplish the following efforts necessary for Minnesota to achieve compliance with Family First. MMB conducted an online survey and qualitative interviews of 81 evidence-based practices currently being offered within the state of Minnesota. And barriers in providing evidence-based practices in Minnesota include items like it's difficult to hire and retain qualified staff, difficult to pay for training and the various certifications, and key features of service are logistically challenging, especially when considering greater Minnesota and distribution throughout counties throughout the state. The facility requirements were included in Family First Policy Bill in 2019, and the certification process is included in the Family First Policy Proposal this legislative session. Department staff have been hired and have been working to implement the many aspects of Family First, and Minute staff are working in coordination with program staff to make necessary system changes to the social service information system. And slides 9, and we'll just start with slide 9 and then transition to 10. There has been significant stakeholder engagement on the implementation of Family First in Minnesota. Hundreds of individuals representing counties, tribes, community agencies, service providers, ombudspersons, elected officials, parents, and youth with lived experience, advocates, survivors of youth at risk of being sex trafficked, and other state agencies have contributed to this effort by participating in a variety of committees and work groups. Stakeholder engagement is ongoing. And when we look at slide 10, you can see that there's also been changes to the SSIS system for federal reporting. The new required background checks for all staff working in congregate care sites has been implemented. And there's also been grant funding for kinship navigated programs and other programs and services to begin the work of Family First. The department instituted the background study checks for all staff employed in congregate care settings. Facilities that are in compliance are listed on the department's public webpage. So this information is available for placing agencies. And that's important because it allows them then to identify the facilities for placement where they will be able to pull down or access that Title IV-E reimbursement. Slide number 11, in addition to the MMB survey for prevention services, they also conducted a survey of children's residential facilities and corporate foster homes to learn how many thought they met most of the Family First requirements and what the most difficult requirements would be for them. The results, less than half of those responding felt they met most of the requirements. The most difficult requirements were accreditation by an international accrediting body. Prior to the COVID pandemic, it was on average taking about 12 months for a facility to obtain that national accreditation from one of the three accrediting bodies. And now with the COVID pandemic, that time frame is greatly extended.
Mr. Sorensen, may I interrupt you on that point? When you say certification, your second bullet on that slide, is that different from this accreditation of a national organizations?
That is the same item, the accreditation of one of the three national organizations.
And so in the second bullet there, you use the word certified to become a QRTP. Is that the same as accreditation by the national associations? Are those different things?
Oh, I'm sorry. Those are different. The certification for QRTP would be a certification through the licensing division at DHS, and it would provide the assurance that congregate care, residential care settings had developed and are implementing all of the required elements in the federal act of what's a qualified residential treatment program.
Okay, thank you. Sorry to interrupt.
Most of the congregate care facilities are willing to come into compliance if financially supported. In our Family First budget proposal, we've included funds to assist facilities in the initial cost of accreditation, sometimes ranging from $3,000 to $10,000. Congregate care facilities must be accredited by one of the three national organizations as one of the requirements to be a qualified residential treatment program. Slides 12 through 14 articulate the items passed in the 2020 session. And I won't go through each of those, but you can see them articulated on those three slides. The new requirement for updating out-of-home placement plans for children placed in a QRTP within 30 days of placement, and requirements for keeping the court informed of this placement. There's a new section in Chapter 260C created to align the state statute with the federal statute. Court approval of placements in a QRTP that are required within 60 days. And then items related to extended periods of time are subject to additional oversight and administrative review, and also extended placement is defined by age. And then flipping to slide 15, this begins to talk about the items that we are proposing for or requesting for this upcoming legislative session. And for our Family First policy proposal for this session, I'll highlight requested modifications that are clarifications that we've identified through really the process of engaging partners from counties, tribes, state court administration, and advocates in order to implement Family First. Clarification of QRTP requirements related to the juvenile court process. Clarification regarding sex trafficked youth or youth at risk of sex trafficking. Modification to successful transition to adulthood federal program. And again, just to highlight, these are items that are either requirements or compliance-based elements for the federal act. Modifications to incorporate QRTP requirements in Chapter 260D, which Assistant Commissioner Lisa Bailey will talk about in just a few minutes. And clarification that the income means test is not required for placements of a child with a parent in substance use disorder facilities for Title IV-E reimbursement. As you may know, that is a new service provision reimbursable by Title IV-E. And then amends definitions, so child foster residence settings, the corporate foster homes or kind of the shift staff foster homes no longer meet the definition of family foster, but rather a congregate care setting, and so they would need to also be QRTPs. Family First is a very large piece of federal legislation that has broad sweeping impact on our system. It allows us to move our lens upstream toward early intervention prevention, but it is not the only initiative that we have moving our system upstream to work with kids, families sooner as they are demonstrating those risk factors that indicate they may be moving toward the more formal child protection services system or out of home placement. But there has been a great deal of stakeholder and community engagement and a great deal of work done to implement this. The COVID pandemic and our work in addressing issues related to that have also really substantially impacted our work and our timelines with Family First. As I mentioned earlier, there is much work to do, but we have a really committed, good group of staff doing this work, and we are partnered with a lot of really helpful, meaningful stakeholders in moving this forward. I don't know if we want to hand it over to Assistant Commissioner Lisa Bailey to go through the remainder of the slides and then open for questions, or however it is that you would like to proceed.
I think we'll have Assistant Commissioner Bailey finish the slide deck, and then we'll open it up for questions and discussion. Thank you.
Thank you, Madam Chair. I'm Lisa Bailey, Acting Assistant Commissioner for Children and Family Services, and I just want to go through a couple of the specific recommendations that we have in a report that was requested by the legislature last session. So I'll just back up a little bit. The Family First legislation applied Family First requirements for these QRTP programs that Director Sorensen was just talking about to both chapters in state law regarding foster care. So that's Chapter 260C, which is about child protection statutes, and then Chapter 260D, which is known as the voluntary placement for treatment statute. And there are advocates who believe, well, back up last year, the department put forward legislation to bring Minnesota into compliance by applying the Family First Act to both aspects of the statute, so to the voluntary and to the child protection statute. Representatives for some of the advocate community, including NAMI and Aspire Minnesota, raised concerns about that. They specifically regarding the application of Family First to the voluntary portion of the out-of-home placements. So during the last session, legislators advised staff that we needed to work with advocates, of course, which we're happy to do, and then asked us to, over this, between the sessions, to work together on coming up with some recommendations about how to proceed. And so over the last 6-8 months, the department met with a wide variety of stakeholders, and we could proceed to the next slide. With stakeholders, counties, and federal partners, policy research, and came up with some conclusions based on all of those conversations. Essentially, what the report, which was provided to the legislature last week, I believe, concluded is that if the Family First requirements are not applied to Minnesota's 260D voluntary foster care statute, they would those placements would therefore not be eligible for for 4E reimbursement. And that would result in counties losing between $2 and $3 million in Title 4E reimbursements every year. The department staff would remove those 260D voluntary placements from our Title 4E plan. We also determined that SSIS, which is our Social Services Information System, is not programmed to distinguish those two types of care, the children placed in foster care through 260D from the general foster care. And so there would therefore be fairly significant difficulties in tracking those cases and trying to determine which ones actually qualify for 4E reimbursement. And finally, we determined that, of course, if the requirements are not applied to those children, then the they would also not receive the federal protections, such as the court involvement, some oversight, essentially additional oversight over those types of cases that the regular foster care population does receive. Next slide, please. We also, however, heard the concerns of the advocates, and working together came up with some recommendations. Essentially that, and this is the recommendation of the department, that the legislature should incorporate the family first requirements into 260D to ensure that those funds continue to flow to the counties. MAXA has taken that position, supporting that. But we also, in recognition of those advocate concerns, would recommend that the legislature develop an option to access those voluntary residential behavioral treatment systems or services outside of the foster care system. Now, if the legislature does not incorporate those family first requirements into 260D, there would be a funding gap. And at that point, we would recommend that the legislature appropriate the annual amounts. We believe it $2.1 million to cover the offset of the lost Title IV-E funding. And then in addition to that, to appropriate funding for SSIS. So essentially, we recognize that the concerns, believe that there is some room for discussion about having an alternate option, but also recognize that that would require fairly significant annual additional funding. And I believe, is that the next, is there another slide? I believe that takes us to the end of that. I'm happy to answer questions. I know Director Sorensen is also available. It's a very complex piece of legislation that's taken us quite a bit of time just to unpack. So I don't expect everyone here to have their questions immediately. We're always happy to answer offline as best we can and provide those to the entire committee.
Yeah, thank you for the presentation, Director Sorensen and Assistant Commissioner Bailey. I have a couple questions. How many organizations are currently certified as QRTPs, and how many will be certified when this is implemented in October?
I can start a little bit, Jamie, Director Sorensen, if it's okay with you. Madam Chair, thank you for that question. At this point, the certification process is just getting put into place. So at this point, we still have part of the legislation that we're asking the legislature to consider in this session that needs to be put into place before we can do the certification process. And that would be handled through our licensing division. And just to back up, you had inquired earlier about what's the difference between accreditation and certification. Accreditation is what happens at the national level. Nationally, all of the facilities need to go through one of those three bodies to get accredited. And then that accreditation is part of our state certification process. We're trying to make that as low barrier as possible. We're not trying to add more hoops for facilities to jump through, but that would be part of, once the accreditation is received, then it would go to our state licensing division to determine if the certification needs were met.
Thank you for that response. So our counties, if we don't have organizations certified or accredited, will counties then have to pay for the services until those organizations are accredited and certified? And is that going to be do we know what that burden will be on our counties?
That is definitely a concern. And I'm going to ask for some assistance from Director Sorensen about, we have heard, of course, all across the country, other states are facing the same problem, trying to get the certifications and accreditations done in time. We know there's some consideration being given to extend that time period, but that is absolutely a concern and part of the reason why we're pushing to get this through as quickly as possible.
Sure, and Madam Chair.
Director Sorensen, go ahead.
Sure, Madam Chair, thank you. I can add to some of the response. So Assistant Commissioner Bailey addressed the certification. In terms of the accreditation, 31 of the 64 congregate care facilities in the state of Minnesota have an accreditation by one of the 3 accrediting bodies. And in terms of the potential loss for Title IV-E reimbursement, in the event that facilities don't obtain the certification and or the accreditation, is projected at $3.5 million.
Thank you. So are we setting up planning funds or using some of the federal planning funds to help these organizations transition to become QRTPs to get the certified and accredited? Besides, I think you have some grant money available of $3,000 to $10,000. Is there anything additional funds for planning to help these organizations?
Sure, Madam Chair, I can respond.
Sir, Director Sarson, go ahead.
We are setting aside funds from the Federal Family First Transition Act, approximately $300,000 for assisting these facilities with obtaining the national accreditation.
So what would that be per facility?
Sure. We did for the 31 facilities, it would be right around the 10,000 per facility.
Okay, thank you. So I see we have some hands up. Representative Pinto, please ask your question.
Thank you, Madam Chair. So a couple things. So one is just with these recommendations regarding 260D, could you just, my apologies for not being very familiar with this. I wonder if we could just get a basic explanation of what it would mean to incorporate family first requirements into 260D. Like what is, I gather that there were objections, as your slide 19 notes, from some advocacy groups about that, but I'm just confused about the basics about what that actually would, like, what's the implication of having that actually happen?
Commissioner Bailey.
Thank you, Madam Chair and Representative Pinto. You're figuring out exactly what we've learned over the last 2 years of just how complex this is. Exactly, the statute requires that for the QRTP for the process for those children, there would need to be court oversight. So there'd be several hearings that would need to happen. What's called a qualified individual who would be appointed to determine whether or not that placement was in the child's best interest. There also would need to be outreach to family and friends who might possibly be a placement option. This is something that some of the advocates have noted as a real sticking point because of concerns that they don't feel that's appropriate to outreach to families in those particular situations. We've included, and I believe NAMI Minnesota is providing, I don't know if they've already provided their feedback on this as well. They've certainly have been part of this. But those are the concerns. It's that additional oversight for what is seen as a voluntary placement.
Representative Pinto.
Thank you, Madam Chair. Just a little bit more clarification. So my understanding, Commissioner, from your answer then that yes, it's a voluntary placement, but the law would then require a kind of a whole lot of extra infrastructure around it. And so as I'm looking at your recommendations, the thought would be that we do have to have those requirements, but maybe there's a way to set up. You've set an option to access residential behavioral health treatment services for kids or families best served outside the foster care system. So essentially would set up a kind of a extra way or separate way to access services. Am I kind of saying that right and understanding it right?
Absolutely. And I'm sorry, Madam Chair, Representative Pinto, and we do have other examples of a couple of other states that have done that, come up with sort of another route to receiving those services. The important part here is that these services are paid for in part, significant part by the Title IV-E funds. And so if we do not apply the Family First requirements to those services, the funding goes away. And so that would need, if we were to set up this alternate route, which is something that the department is absolutely willing to consider and work towards, that funding option needs to be, or that funding gap needs to be recognized.
Thank you,
Representative
Madam
Pinto?
Chair. Thank you, Madam Chair. And then just on my second topic was just had to do with the your Family First policy bill regarding sex trafficking. There's a clarification. You say adding protections to children who are victims, and then some mandatory training. And I'm real interested in finding out more details about that. I suppose we probably will as that bill is in front of us. So maybe rather than taking more time now, I'll just note if the department has some details on that, even in advance of our hearing, I'd love to get it. And then I know the bill will be in front of us. So thank you, Madam Chair.
Thank you, Representative Pinto. Representative Noor.
Thank you, Madam Chair. Thank you, Assistant Commissioner Bailey. I was in the middle of the discussions during the last conversation when we presented the bill for the agency. I know that NAMI and other stakeholders were planning to continue having the conversation about the 260D. I know you briefly touched about it. What is the holdback even after spending several months? We changed the changes to implementation to make sure that their concerns are addressed. What was the challenge from reaching consensus in terms of moving forward?
Commissioner Bailey?
Thank you, Madam Chair. Representative Noor, thank you for that clarification. So at the last session, if everyone can recall, it was happening right at just as the pandemic shutdown was happening, and the compromise that was reached was that the 260D, the Family First requirements were not applied to voluntary foster care last year for the voluntary placements, and that the parties were all instructed to go talk about this and come back with some recommendations and some more analysis of what the repercussions would be. So we're now back before you after having talked about this at great length, having determined that from the department's perspective, we continue to ask for those requirements to be applied to the QRT, the voluntary placements, the 260D, and we've outlined and figured out about how much we think that would impact the counties if it's not applied, and looked at some other options. My understanding is, and as I've said, MAXA is in support of this. My understanding is that NAMI is also supportive to, at this point, to applying the Family First to 260D. And so I don't want to speak for them, but that's what we've been informed.
Representative Noor?
Thank you for the clarification, Assistant Commissioner. Thank you, Madam Chair. Just another question. I know 4E technically disproportionately impacts communities of color, BIPAC. I just wanted to inquire, even with the programs for the navigators, I think, which is included in this process, what is the plan in terms of reaching consensus? I know Chair Moran had initiated a big initiative to make sure that we're more inclusive and we address the needs for the African-American community, who I think in general shows a significant or disproportionate impact when it comes to 4E.
Commissioner Bailey?
Thank you, Madam Chair and Representative Noor. Could I ask for clarification on your question? Are you talking about for Family First in general, or specifically about this 260D question?
Representative Noor?
So I'll clarify. I think to come to one of my question in that big question that I asked in terms of complexity, the Family First Act included kinship as part of the Navigators program. Are we looking into kinship navigators as we look into how we implement some of these changes?
Commissioner Bailey?
And Madam Chair, Representative Noor, just to clarify as well. So are we looking into the equity impacts of the kinship navigator requirements? Is that your question? And if it is, correct, I can say absolutely.
One final question, Madam Chair.
Go ahead, Representative Noor.
You mentioned that there will be additional cost when it comes to the SSIS systems. Are there any costs that we're going to be incurring because of the changes, or is it fully federally funded as we implement the Family First Act?
Commissioner Bailey?
Thank you, Madam Chair, Representative Noor. And I do want to just back up really quick. I've just been informed. I want to correct my earlier statement. Our understanding is that NAMI supports the third pathway, the asking for the legislature to establish an alternate option for those voluntary placement kids. So I want to just clarify that, and again, don't want to speak for them. So I hope I said that correctly. In terms of your question, Representative Noor, the SSIS costs are partly paid for by the 4E funds. In fact, I think I can't remember what the percentage is. If it's we did receive funds in the 2020 budget to pay for those costs. However, if the Family First requirements do not apply to the voluntary placement option, those changes would need to be paid for out of general fund costs or another alternate payment source. So it's only if they are covered and part of the Family First requirement.
Representative Noor, does that answer your question?
Thank you, Madam Chair. I know the complexity with the system requires more deep understanding, so I'll be taking some of my questions offline with the department. Thank you so much.
Thank you for those questions. Chair Liebling.
Oh, thank you, Madam Chair. Boy, this is really complicated stuff, but so incredibly important. So I did want to ask when Director Sorensen was speaking about how equity is reflected in the Families First. There was no explicit discussion of this when he went through the slides, and so much of this is deeply impactful on equity, as we know from a lot of the work, especially that Chair Moran did in the last couple of years. But so I wanted to hear a little bit more about that. And then secondly, I had just a more focused question, but I would let him answer the first one, big one first, if he could.
Director Sorensen.
Yes, Madam Chair, Representative Liebling, thank you for the question. Decentering whiteness, anti-racism, and equity are primary priorities within child safety and permanency, all of our work, including Family First. As you may know, the federal legislation is constructed in such a way where the evidence-based requirements for prevention services have led to well-supported and supported and promising practices that are not tailored for African American children, families, communities. They're not tailored for American Indian children, families, communities, and tribes. And we are doing advocacy work on that front, but we are working very closely with the Indian Child Welfare Act Council and tribal members in the development of the prevention plan. And we are engaging a number of initiatives beyond Family First to attend to decentering whiteness, anti-racism, and equity. So our charge is to try to make sure that in the clearinghouse, there is the ability to have the kinds of services that communities want for their children and families to drive the outcomes that they identify to them are important for their children and families. Given how the federal act and the clearinghouse is constructed, that is a challenge. And it is a challenge that is echoed throughout the nation in every state in their implementation of Family First.
Chair Liebling.
Thank you. Thank you for that answer, Director Sorensen. My other question probably is to Commissioner Bailey, and that has to do, could you just be explicit about how this is all reflected in the governor's budget, if it is? And then, and also just sort of a question about the potential, I guess, third pathway it was called for voluntary placements. If we did this outside of Families First, that it just occurs to me that maybe all the cost would not have to be borne by the state or by the counties, because we could tap either families who have insurance, right? Or I'm asking, would this be available, that there would be funding through insurance, or that we could have some kind of sliding scale contribution as well? So I just wanted just a bit of discussion about that. I don't want to take too much time with that specific question. Thank you, Madam
Bailey.
Chair.
We have time, so if you need to elaborate, please do so, Commissioner Bailey.
Thank you, Madam Chair. Representative Liebling, in terms of the governor's budget, there is a request for the Family First, I can't remember what we call it. I think it's continued implementation. I believe it's 2.1. I'm sorry, I don't have the numbers right in front of me. But that is its own request specifically for the several policies that Director Sorensen mentioned, having to do with the implementation of this next phase on getting us to October and beyond with the establishment of those services. In terms of the funding for that third pathway, that's outside my scope, I'll admit, but it's absolutely something we started discussing and would think that there are other options available, and that would be something we would be willing to explore and work with, probably with our behavioral health department and others at DHS who are not in the foster care area.
Chair Liebling?
Yeah, thank you. And I see that Mr. Burdick probably wants to throw something in here as well, but also the piece about, whether if we did this, the voluntary pathway piece, if we did that separately, whether we would be able to tap other insurance funds and other funds. I don't know if you did.
Mr. Burdick or Commissioner Bailey? You're muted, Mr. Burdick.
Thank you, Madam Chair. The Perils of Technology, Matt Burdick with the Department of Human Services. On that question, these services currently do blend through the foster care system 4E funds and Medicaid funds for the treatment portion. Unfortunately, many of these facilities have been declared institutions for mental disease, or IMDs, so we currently state fund the treatment portion. Medicaid also does not pay for room and board costs for residential care. And so in the foster care system, we typically use the 4E funding for that portion. However, we do have state-only mechanisms to pay for room and board. So it will really depend on how we design this model, but it's likely that it will largely be state funding. However, there have been conversations at the federal level about providing exemptions to the IMD exclusion to allow federal Medicaid dollars for some of these programs. So that's another factor to consider as you're deciding which path to go with.
Thank you, Mr. Burdick. Chair Liebling?
Thank you. That's great. Thanks for the response.
Representative Moeller.
Thank you, Madam Chair. And I have a question about the preventative services. And Director Sorensen, you did address some of this with respect to the equity question, but I'm just curious what types of preventative services that you're looking at or we're talking about here. Are they for the adults? Are there preventive services, particularly for children who've experienced trauma? If you could just talk about what some of those services are, I'd appreciate it. Thank you.
Director Sorensen.
Thank you, Madam Chair. Thank you, Representative Moeller. The services that are allowable for Family First prevention services are those identified as well supported, and promising in the federal or national Family First Clearinghouse. Right now, there are only 22 services listed in that clearinghouse. And the Title IV-E in Family First is also the pay source of last resort. And so many of the services that exist are oftentimes paid for by medical assistance or other supports. So the ability to pull down funds right now is a challenge for all states. In terms of the services focused on equity for our American Indian tribal partners, what's important to them and what we're partnering with them on is to support an assessment of the current existing menu or array of cultural ceremonies and traditional healings targeted at both children and parents or caregivers. And then to do the work of advocating, but to also identify where can we put those in Minnesota's proposed prevention plan. There was recent information memo public instruction released by federal ACF that allows for minor alterations to existing evidence-based practice to accommodate culture. However, in general, the response has been that that's not sufficient. It's very difficult to take an evidence-based practice that's been established based on a study of white children and families, and then just make a couple of minor tweaks and have it meaningful for African American children and families of African heritage and American Indian children and families. And so we are constantly monitoring what's in the clearinghouse. There are also right now 44 services that are up for review in hopes that they will meet the rigor of evaluation that's required for being included in the National Clearinghouse and trying to be part of the national conversation advocacy around that as well. There are other states who have begun to submit services targeted at different cultural sovereign populations. And so we are monitoring to make sure we include those in our plan, and that in the breadth of our plan, we also identify those cultural services, those traditional ceremonies that we want to begin to evaluate to create as evidence-based practice. I'll just make one small note with American Indian, ICWA Council, and child welfare agencies. We're very vigilant about exposing those services, those ceremonies to a Western evaluative lens. And so we would be advocating for indigenous methodologies in terms of evaluation and making sure that we don't strip those particular services or ceremonies of what's culturally meaning to them by exposing them to really the evaluation process created by Family First and the National Clearinghouse.
Thank you, Director Sorensen. Representative Moeller.
Yeah, thank you, Madam Chair. And I guess just more broadly for those 22 items that are listed, I'd be curious to know what those are and if that's something that you can provide the committee with. I would certainly appreciate looking at those.
Madam Chair, Representative
Go
Moeller.
ahead, Director Sorensen.
Yeah. Absolutely, there's a national website, and we can forward that website so that you can see the services in the 3 domains submitted for review, and then the current approved, well-supported, supported, and promising practices.
Great, thank you, Director Sorensen. Other questions from members? I don't know, Representative Sandell, if you had your hand up earlier.
Well, thank you, Madam Chair. I agree with Representative Liebling. It's complicated, particularly for somebody who's new to the committee. And I was a teacher for a long while, and I know that many of the students that I had in class were foster family placements, and some, it seemed to me, were just fine and great. Others were less beneficial and satisfactory. Once a child is placed in a home, particularly when we consider all of the issues that have been discussed here today, who supervises and how closely is the child's welfare supervised?
Commissioner Bailey or Director Sorensen?
Madam Chair, I think that falls right into Director Sorensen's wheelhouse. I'll let him answer that.
Okay, Director Sorensen, please.
Sure. Madam Chair, Representative Sandell, thanks for the question. In Minnesota, it's a state-supervised, county-administered child welfare system. The county child welfare agencies at the local level and the tribal child welfare agencies have direct responsibility to kids and families, and they work with their respective legal counsels and respective courts to work with children and family, particularly those in out-of-home placement. There are state and federal requirements for the level of engagement and face-to-face contact with children and with their care providers. It requires the child care worker to have contact alone with the child and also in the child's setting. So there's a lot of variables. It depends on a particular local agency's staffing structure, how many cases they have assigned, what that worker to caseload ratio looks like. It depends upon within any of these local communities, the service array that they have available. So in those jurisdictions where there are few services, where there's a lot of geography and a lot of transportation that occurs for the child care worker, and then also for those particular counties where there's a lot of cases. There's variance in terms of to what extent child welfare workers are engaging with kids and families. Additionally, what I would say is in 2015, Minnesota's child welfare workforce expanded through funding from the legislature. And just in the last few years, we've been positioned to better focus and address child welfare workforce knowledge and skills competencies. And so we are very invested in the development, the stability, the well-being of our child welfare workforce to ensure that they are interfacing, supervising, engaging children and families in accordance with best practice, in accordance with cultural affirmation, and in a manner that keeps kids together with their families and drives well-being outcomes for kids throughout the state.
Representative Sandell.
Madam Chair, thank you. Thank you, Mr. Sorensen. Among the issues that I observed were the transition, and I hope that doesn't sound too ethnocentric, but the transition from an immigrant family to a second generation family. Issues of language were really huge, and cultural traditions, of course, were really important as well. And maybe we can talk about that at another time. But I admire the work, and I know it's enormously sensitive and difficult to do. But thank you.
Thank you, Representative Sandell. Any other questions from members? I don't see any hands raised. Oh, there we go. Representative Noor, go ahead.
Thank you, Madam Chair, for the opportunity again to ask a little bit of a question. I think the director mentioned a little bit about removing some of the barriers for kinship and relative caregivers in out-of-home placement. And I just wanted to inquire, I think we can remove some of the barriers. Can we allow some of the money to be targeted, allow the counties and the tribes to be able to apply some of that resources to promote more kinship or family caregivers in the out-of-home placement?
Commissioner Bailey or Director Sorensen?
Again, Madam Chair, Director Sorensen has been working very hard on this particular issue, so I'm going to allow him to proceed.
Director Sorensen, please proceed.
Sure. Madam Chair, Representative Noor, thanks for the question. Kinship is incredibly important, and we know that when someone is kin or related to a child, they stand to hang in there longer to help with complex behavioral issues. We also know that it allows for, contiguous culture and connection to extended family. So it is a top priority. We have been working with Lutheran Social Services and Wilder to develop and study, and this is with a cohort of counties, kinship best practices. And this is part of our work with Family First. And so kinship navigation and placing children when they absolutely cannot be safely maintained in their family or caregiver's home with services applied, that kin and relatives are rigorously explored, pursued, and developed. We also are in the process, and there are discussions about the particular um, elements that can maybe become problematic in terms of a family member or kin becoming licensed, and trying to look at those standards to make sure we aren't creating barriers there that don't necessarily have to be there. It is a top priority that if a child absolutely has to be removed from their home, that they be placed with a kinship provider. Within the National Family First Clearinghouse, there is one service focused on kinship. There are also some recent federal funds that have been allocated and made available to expand kinship work in states. We are waiting for, I believe we just received information memos and public instruction last week. We received probably about 5 in 1 week. And so we're sorting through those to begin to figure out in Minnesota, what is the application of those funds? How can they be spent? And what are the priorities? And in terms of our thinking through them, that decentering whiteness, that equity, that cultural lens, in terms of whatever it is we determine around policy and practice and resources and contracts.
Representative Noor.
Madam Chair, thank you. Thank you, Director Sorensen. And I'm glad to hear that there are resources set aside. I'm hopeful that the counties and the tribal government will be able to apply some of those resources in promoting kinship and caregiver, so that we can actually unify that family. So my next question is parental unification. I understand there's several challenges, even through legal representation. Many of the parents don't have the resources, don't have the capacity. What are we doing to provide legal representation to advocate for the parents, and also implementation of parental unification when the time is right?
Director Sorensen.
Madam Chair, Representative Noor, with some of the questions posed, they're almost large presentations in and of themselves because they're such rich topics. Child and high quality child and parent legal representation has been proven to drive desirable outcomes for children and families. And so we have been doing work with some counties to determine how we can pull down federal Title IV funds to help pay for child and parent legal representation. And we have just successfully been able to do that with Hennepin County. And we'll continue to expand that. But we are partnered and in discussions with multiple stakeholders about the importance, the development, the implementation of child and parent legal representation in these proceedings in Minnesota. And there is certainly a cost factor. There is certainly an availability factor in terms of the legal professionals out there throughout the state to provide this service. And certainly, once we do have a model and something we want to implement, the package around how that training occurs for those professionals. So there's lots of elements to it. It is a priority for us. We are working on it with a number of additional stakeholders. And if something hasn't been proposed or made known, we're hoping that something is proposed in terms of a legislative request in the not too distant future.
Representative Nora?
Thank you, Madam Chair. I look forward to that conversation. Hopefully we can have legislation to address the imbalance that exists when it comes to the foster care system. So thank you.
Thank you. Any other questions from members? I don't see any other questions. Well, thank you, Acting Assistant Commissioner Bailey and Director Sorensen for the presentation. I appreciated all of the questions from our members. I think there's a great interest. I look forward to updates from the agency as you're starting to implement this program. And I encourage members to contact DHS to follow up for more information, or if you have more questions as you look through the slide deck and other materials that are available from the DHS website. So moving on through the agenda, the next item, I'm going to share my screen. Can everyone see my screen? Oops. Okay, Representative Sandell, can you see my screen, my slides? Yes, excellent. Okay, whoops. So I am going to briefly emphasize what has been discussed throughout the summer and the fall. So I'm going to focus on the recommendations from the Select Committee on Racial Justice. This is their final report. I encourage members to listen to the Select Committee hearings. I think they met 6 times. And for a summary of the report, Chair Moran and Ways and Means Committee on Monday in the House went through a presentation of the report. So I'm only going to touch on things, the recommendations that apply to this committee and Human Services. But I encourage members to read the report, go to the testimony, particularly of the Select Committee, and stream the recording from the Ways and Means Committee on Monday. So the Select Committee started with a resolution in the House during the second special session of last year that declared racism to be a public health crisis affecting all Minnesotans. And it established several avenues through which we as representatives, we have a significant role and a significant responsibility to address racial equity in the state through our policies, through legislation. And the emphasis is to have use a racial equity lens to look at all the legislation that's being considered in every committee. So we want to do that here, and I appreciate all of the questions that members have posed around families first and equity issues. So the report looks at, and the committee looked at disparities in specific areas in the economic disparities, housing disparities, education disparities, disparities in health and in public safety. And I'm not going to read all of these slides, but here, if you want more information on how racism, structural racism, systemic racism, institutional racism is defined, please review these slides. And I'm going to highlight some of the disparities and issues that I hope members will focus on in this committee. One inequity identified was around family separation. So research should suggest that multiple out-of-home placements are very harmful for children and families. And historically, children were most often removed from their homes for neglect. But in recent years, the majority of children entering our foster care system is due to parental substance use disorders. And subjecting families to unnecessary involvement of child protection agencies has detrimental human and socioeconomic implications, especially for our BIPOC communities in Minnesota. So in order to facilitate placement in the most supportive and healing environment, it's critical that DHS continuously monitor and assess conditions, including those that resulted in the placement and the conditions within foster care placements. Out-of-home care is also an issue, and we have disparities in out-of-home placement. We have significant racial disparities in out-of-home care that disproportionately affect Black and American Indian children. Compared to white children, Black children in Minnesota are 2.3 times more likely to be involved in a report of maltreatment and 2.9 times more likely to experience out-of-home placement. In 25 states, the District of Columbia, and one Indigenous tribe, they are participating in a federal child welfare demonstration project, giving them the ability to better allocate their share of the Title IV foster care dollars. And Minnesota is not currently participating in this demonstration waiver. The recommendations specific to human services from the report, and I hope members will look at each recommendation and work on legislation to address these concerns. But one is to expand the current exemptions that provide healthcare workers discretion from requirements to report substance abuse, allow Minnesota and tribes to apply for a waiver so that they can better target their share of those Title IV foster care dollars, remove barriers and prioritize kinship and relative caregivers in out-of-home placements, create a task force for legal representation of parents that expands and evaluates high-quality models of parent representation, resulting in lower cost to counties, fewer foster care placements, shorter times to parental unification, and more stable reunifications with fewer foster care reentries. Provide grants to community-based agencies who serve Black children and families to provide services for family preservation, relative care engagement, and reunification services. Mental health consultation pilot for mandated reporters. It's a school-based mental health consultation pilot for mandated reporters. Strengthen our legal representation for removal, require a description of actual agency efforts, including an agency's assessment of child safety and alternative family or kin-based arrangements as part of a court order for removal. And develop a BIPOC family mentorship program where communities with the greatest disparities in out-of-home placement have access to representative family members to support them in navigating the child protection process. So this quick summary highlighting those recommendations from the Select Committee on Racial Justice report, those have been posted on our committee website. So please take a look at the report and stream the hearings and hear the really important testimony that was given and the testifiers conducting research in racial disparities and racial justice. We all have a lot to learn in this area, but we all have a really important role to play to address disparities in racial equity in our state. And with that, we are through the agenda, members. Does anyone have any comments or questions before we adjourn? So tomorrow we will hear part of the governor's budget and human services. So get your rulers out, print off the material for tomorrow. Oh, I see that Chair Liebling has her hand up. Go ahead, Chair Liebling.
Yeah, thank you. I just wanted to add, I hope you can hear me. I just wanted to add, there's a lot there. Thank you so much for talking through these recommendations. And I know Chair Schultz, you mentioned to members, to work, you hope that you'll get bills on these. And I just wanted to kind of emphasize we're in this restricted environment where it's really hard to get things drafted. It's really hard to get things through the revisor. So I just wanted to, again, suggest to members that if you want to take up one of these issues, that you talk to Chair Schultz, just so we can coordinate and make sure we're not having 3 different members work on the same issue without knowing each other is working on it, and that we don't send duplicate bills or 2 similar bills to the revisor, not knowing that we're doing that. So just wanted to flag that again. Thank you.
Yes, thank you for flagging that, Chair Liebling. It is important to communicate with the chairs of the committees, and many of these issues cross more than just this committee. So I would encourage you to contact me and also contact the agencies to get support and just start to investigate these areas to learn more about them. I know many of you are new to human services, so the agencies have a wealth of information and data to help you learn about and get the background info you need to start working in these topics. I see Representative Pinto. Go ahead.
Thank you, Madam Chair, and only because we do have a minute here, I just thought I would note, and since our committee hearing today is focused so much on child welfare issues, both in the presentation from the department and then so many of those recommendations from the select committee, I guess I just want to highlight that that it does feel to me that that is an area where the rubber really hits the road as much as any other area when it comes to our state's racial disparities, not only in terms of what happens actually in that system, but then the children who were impacted by that system and those families. We know that the impacts then roll off into all kinds of other areas as well. And knowing how all that spins off, I tend to think about those things especially from the youngest child perspective. My role is chairing my committee, but even beyond that as well. And it feels like it's an area that sometimes can get lost a little bit. And I know that you, Madam Chair, and members of this committee will make sure that does not happen. But I guess I'm really just kind of wanting to highlight that today in particular between the department's presentation, which and things get kind of confusing, and then especially that select committee recognizing just how critical this area of child welfare is and how tough it is. And I think sometimes it's so tough that we tend to back off a little bit from it because it's just so challenging. It tends to be an area where there are not a lot of good answers. Sometimes it can feel like having a child remain in a given situation seems really problematic, but we know that removal is so often even more problematic for kids and families. And so I guess I just kind of want to encourage all of us to really dig into that area in particular. Thank you, Madam Chair.
Thank you, Representative Pinto. And the benefit of having a large legislative body is that we can be champions of issues and be experts in those areas. So I think Representative Pinto and others have identified that if you want to step up and be champions in child welfare or other areas that we talked about today, please do so. We need all of our members to work towards these issues in a bipartisan way. So this is a real call to action especially for you new members that are looking to become champions in certain areas. We need you to start working on really important issues, so vital to the children and to the families in our state. Any other comments from members? We barely have time left in this committee, so I don't see anything. So with that, members, enjoy the rest of your day, and we will see you back here tomorrow at 10:30. The meeting's adjourned.